Hello, this is Katia, your midwife. Today's video is about baby shopping. So last time we were talking about mom's shopping, what to buy during the pregnancy. Today we're gonna talk about what to buy in preparation of your baby's birth and in the first few weeks of your baby's life, right? So just like for mom's shopping, I'm still this very practical person, so I don't like to buy loads of things, and I don't like to buy things that to me are useless, okay? And I don't want to surround myself with too many objects around the house. So, what are the essentials? Just like for moms, you need clothes for the baby. In terms of sizes, obviously it depends on baby's weight when they're born. If you're doing a third trimester scan, they could give you a good estimate of the baby's weight by the time they will be at term of your pregnancy. But obviously the weight can vary, and babies go through growth spurts, or anyway they do grow quite quickly, so I wouldn't recommend you to buy too many items of the same size, so buy different sizes. If you watch my video about what to put in your hospital bag, you will have a visual of what baby clothes look like. But in general, what you need to buy are baby grows, body suits or body vests, hats, not too many, just for going out or anyway the first few hours at the hospital, socks, and then obviously jackets, depending on the season. As I said, no, don't buy too many of the same size. If you're going for newborn size, which normally covers up to around 3.5 kilo baby, so 7 and a bit ounces, pounds, sorry, then you want to buy like 5 or 6 changes of those clothes just for the first couple of weeks, and then you'll take it from there. Luckily, we live in a country where shops are they're very nearby. So if you need to pop to I don't know, a big Tesco's or M&S, I don't know what's closest to you, which have a baby clothes department, you can always go there, buy them, pop them in the washing machine, and you're done. So you don't really need to buy a bulk of things. And also remember, you've got friends and family who are going to inundate you with baby clothes. So obviously, again, don't buy too many of the same thing. Stay quite cheap, I would say, because especially with bodysuits, you're gonna need loads of them, especially the first few months, because babies poo, and then when they start weaning after 6 months, they're gonna make a mess of everything. So just stay cheap. Don't spend too much money on baby's clothes unless you have special occasions and you want to buy that cute top or the cute dress, the cute set for your baby. It's absolutely fine. Then you need a bed for baby, not necessarily, but you may want to think about it. And it could go, again, different sizes. It could go from a Moses basket for the first few weeks, little cot, crib, or crib anyway, and a cot bed. That's really depending on how big your bedroom is. If you have quite a large bedroom where you could put the cot bed just next to you, and cot beds are normally measuring about 120 by 60 centimeters, so it's a small bed, and you have space for that next to you, then obviously just go for it straight away. If you have a smaller bedroom, maybe you want to go for a Moses basket or a small cot, which normally would last you for about 6 to 8 months, depending on how big your baby is. And then after that, you may need to transfer your baby onto a bigger bed. If you're bed sharing, then you don't need any of that. So the main thing is either if you're bed sharing or sharing the room with your baby, so having the baby sleeping next to you in a cot, is the mattress. So you can buy second hand of beds for babies, but the mattress must be new, must be clean, obviously, and must be firm. Okay, so firm, flat surface for the baby, free of everything, free of all soft toys, any other toys, no bumpers around it, and we're gonna have another video in the next few weeks about child safety. No pillows until they're at least 1.5 or 2 years old. You just need a flat, firm surface, and obviously the bedding. So in terms of bedding, you just need a few fitted sheets. I would go for fitted sheets just because if you go for a cot bed or a Moses basket, it's easier to make them. Okay. And then you've got the blankets, or anyway the top sheets. You can use sleeping bags as long as they are the right size for your baby. There aren't really sleeping bags for newborn, and I wouldn't recommend to use sleeping bags straight away. Although in some countries like Germany and Switzerland, I know that they make very tiny sleeping bags from the hospital as well for newborns. So if you want to try them, or you have friends who live in Switzerland or Germany, see if they can find you a very tiny sleeping bag. Otherwise, before 3 months of age, I wouldn't recommend you to use one, because they would normally, even if they say 0 to 3 months, they would be quite baggy for a newborn baby. And there's always the risk of overheating, especially the first few weeks where you don't know how much you need to cover a baby. And then after bedding, obviously you want to go shopping for prams. Prams, again, I'm going to make another video about what kind of prams for what kind of family you want to buy, but I would recommend you to go and find prams from when you are around 30 weeks pregnant, so about a couple of months before you give birth. Normally, if you go, either you go to a baby show, or I don't know, if you go in a shop, they would have things in stock, but normally for pregnant couples, they would ask you your due date, so to send you the pram around 4 weeks before your due date, so you don't have too many things around your house. And these are the top 3. Then obviously you will need nappies and everything you need for baby's toiletries. During the first month, you won't need to use any soap, unless obviously the baby has a bit of crusted blood or mucus from the birth on their head. You can use a couple of drops of soap just to help remove that little deposits on the baby's head. Otherwise, for the first month, just use plain water for the baby. So for the first month, you don't really need to buy anything for baby. You don't need lotions or moisturizers, unless obviously baby's skin is cracked and bleeding, but that's something that we're going to talk about in the next few weeks. So you don't really need much in terms of baby's toiletries. After the first month, I would say a month, because in some countries the water is quite hard, and also baby's skin is very delicate. It has to adapt, and also they don't sweat, they don't really stink, so you don't really need to wash them with loads and loads of bubble. They don't need a bubble bath, they just need a little rinse through, and every time you change the bottom, anyway, anytime you change the nappy, you will clean them thoroughly, so you don't really need much soap. And then that's it, really. So again, very practical. You need clothes, you need somewhere to put the baby to sleep if you want to, otherwise that's going to be your bed. Then you're going to need a pram, probably. If you don't want a pram, you can baby wear, and that's going to be the topic of another video. And then you need nappies and toiletries at some point. Okay. Other gadgets like cot bumpers, bed bumpers, pillows, and baby pods, like sleeping pods, cocoons, are really contraindicated. Just go on the Lullaby Trust website and you'll find out why. These are SIDS hazards, so they could put a higher risk on your baby to die of sudden infant death, so the cot death. I don't want to scare you, I don't want to put anxiety on you, but you need to think about what's best and what's safe for your baby. The fact that friends and family used that and nothing ever happened, it's good, but it doesn't mean that these gadgets and these things are safe. Okay, so be very, very, very careful. Just to explain something to you, these baby pods, these cocoons, they are basically made with the same material of a duvet. So it's as if you put a baby to sleep on a giant duvet, well, on a smaller, thicker duvet. Okay, so there is the risk of overheating the baby, and the surface is not firm enough for them because it's normally very nice, very soft. There are the memory foam ones. The memory foam ones are even worse because they would increase the baby's temperature a lot because they're all synthetic fibers. And also some of the memory foam ones have a little support on the underneath the legs that keep the legs higher, so to emulate the fetal position. And they say, oh, that's the best for babies to sleep. It's not the best. Once the baby's out, the baby has to explore the world. The baby has to stretch, has to have the opportunity to fill all the space around them. So if you confine them in very tiny spaces, as well as when you swaddle them, first of all, it would compromise the hip development, and then it would lead to overheating, and also will lead to containment syndrome, which is something very serious. That means not only a developmental and behavioral change where the baby won't sleep if not in a very confined space, but it will lead to a wrong development of their spine and all their bones and ligaments. And that would need then in the future visits to osteopaths and chiropractors just to sort things out. So just think about it. If you need more information, if you want more support about what to buy for your baby, just put a comment under this video or message me or book a 15 minutes free consultation or an appointment with me, so we can go through all your questions and I can clarify all of your concerns and doubts to you. Thank you very much, and I'll see you next time. Bye bye.